Hello everyone, my name is Jane Yip. I'm a neuroscientist and a behavior analyst, and I have worked with adoptive children, adoptive and foster children for about 10 years now, and I have gone through thousands of cases. So many adoptive and foster parents come to me because their children has behavior problem, namely maladaptive behavior problem. So today I want to talk about two representative cases that many of you have come to me for. One of the first case, which is very common, emotional instability. So your child would melt down at a drop of a hat, sometimes seemingly without any good reasons, and definitely very allergic to the word no. And daily life seems to be a battle. So I want to address the underlying reasons and how we can handle these children and help them stabilize emotionally. And then the second case is, as more often than not, you don't just adopt one child. Department of Child Services or adoptive agency may call you and say, hey, we have their brother or sister. Something has happened to their biological parents. Will you be so kind to have them as well? And in your goodness of heart, you do not want to break apart sibling pairs. So you adopt them. And that's when all hell breaks loose. Instead of siblings getting along with each other, which, bear in mind, even healthy neurotypical siblings struggle with each other. And when they are adopted and when they have been separated for a while or introduced, you would expect even more issues. And I want to deal with the second case studies, and I will be providing series of seminars that deals with different, what I call categories of problems. So to help you understand, let's enlist your common sense. I think that's a good starting point. It's understandable that if you're adopted, you're fostered, your biological parents give you up for whatever reasons, you don't feel secure about the world, about yourself. And I don't know if you ever had the opportunity to adopt an animal from a shelter, a dog or cat shelter. They are very different from animals that are biologically produced from your pet. Now we are more than an animal, we are more than a pet. I want you to understand the magnitude of that fear and insecurity in a human being. No matter what size the child is, I want you to see the child as a fully fledged human being, because they are. So the problem with them is they are not aware of their insecurity, they are not aware of their fear. The only way to communicate is as babies through crying, as toddlers through tantrum, as an older child, 9 or 10, maybe defiance, and so on. So depending on the age group. As teenagers, what we call argumentativeness and all kinds of things, and getting in trouble, running around with the wrong friends. Those are all expression of distress. Let's back out from just looking at their behavior and let us understand the underlying emotional state. Because why? We are all emotional beings. We go through emotions first before we think and we make decisions. Is that correct? We feel first. So when you don't feel right, and you might not even be able to know that you don't feel right, something just does not sit well. Have you ever met a child that is so critical, nothing is right? They could be bathed in paradise. They will find something wrong. So there is a sense of unease within them. So rather than trying to shut down the behavior, which we have to, and we're going to talk about that next, but the first thing we must address, which most of us, including myself, forget when we are faced with a troubling behavior, is the underlying emotions. So know that emotion is there. You are emotional as well. So before you put out the fire in another person, let's put out the emotional fire in yourself. So my advice, the first step is recognize that you don't feel secure either. You want to shut down the other person's troubling emotion, which is normal. All of us do that. It takes training not to do that. So therefore, if you come to my treatment center or seminar, I will train you to be able to get to a level of self-control where when faced with critical emotion, you are not reacting, you are responding. So the first thing you need to do is to get to a position of ease within your body. Yes, it can be trained. And then you have to learn loving detachment. You still love, you still care, but in your mind, you develop some level of distance, right? It's called a loving distance. Because if you are enmeshed, you're not able to help another person. You cannot afford to be enmeshed. So you stand strong. If it helps, we are, first of all, a body. I want you to get in touch with your body. Touch your body if you need. You can do this, you can tap your body, you can breathe, you can look at a tree, anything, ground yourself, breathe, and then say, okay, am I solid in myself to deal with the problem? So to a crying child, tantruming child, defiant teenager, or whatever you are dealing with, first thing you would have to say is, calm down. Now, if calm down is an offensive term, use another word. Let's do this or look at that. When you use a calm tone, you will infect your calmness to another person. Do you know emotional state is even more infectious than a virus? So, if you are sufficiently confident and grounded in your emotion, your authority through your emotional stability will be like a vessel to hold the unstable emotional state of the other person. So this needs more practice than mere words. I hope that you understand what I'm trying to say. So for somebody who is emotionally unstable, what you have to do is to stabilize them emotionally before you rationalize, before you give them rules. They have to feel comfortable. Point number one. So to a crying tantrum, calm down before you talk to them. Do your best to calm down. If it takes 10 minutes, 30 minutes, 2 hours, I'm afraid you would have to ride through that. It may take you some time to get them used to calming down. You don't really have to use a lot of words. A few key words will do. If they are hurting other people, of course you have to remove them, get them to a safe place, and you don't really have to restrain them either, depending on the situation, because some of them may see that in a negative light. Basically, all you have to do is, in a peaceful state, with authority, command them to calm down, right? Once you get them to a calm state, when the storm is over, and then you deal with them in the next level. So, unfortunately, many of us use emotion to get what we want. So, what the next step will be You cannot do it during the time that they are upset, of course. You can only do it during the time that they are calm and collected and happy and enjoying themselves. So they have to learn the right way to ask for things. Please, thank you, may I have this? Keep training. And be disciplined enough not to give them what they want when they are rude to you, when they do not ask the right way. If you want, you can display all these rules. You get what you want by using this phrase, keep training them to do that. That's training program number 1. Training program number 2, you can get what you need, not always what you want. This is life lesson that all of us, including each one of us, have to learn. We cannot have everything that we want. They have to learn to go without. They have to learn to desensitize themselves to the word no. Desensitization program can be tricky. You may need a professional to take you through that. It can be done. And takes patience, takes practice, takes organized method to get them desensitized to the word no, and then you cannot say no and stop at that. No creates a vacuum. That vacuum needs to be filled by what's called options. What are the other options? And I advise giving your child, teenagers, whatever, an option box. If this doesn't work, let's do this. Teach them to be creative. Teach them to come up with their own ideas on how they can entertain themselves. Because why? You want to foster creative thinking. By the way, when people are upset, they are working at more basic level of the brain, which is the fight and flight center. When people are creative, they are accessing higher cortical centers. The frontal lobe. The frontal lobe controls judgment, personality, good decision. So encourage them to be creative. Many ways to be creative: drawing a picture, figuring out, hey, if I cannot play with this, maybe that, or maybe I can come up with another way to get what I want. Teach them creative problem solving. So I'm going to recap. When your adoptive or foster child is melting down, creating a lot of emotional chaos, what I want you to do is, number 1, stay calm. Number 2, during the time that you are having good time with them, I do suggest that you actually schedule time to play with them, to spend quality time with them. Teach them to ask for things nicely. Teach them to handle frustrations and not getting their way, and practice that. If it is hard for you to do it, I suggest you enlist the help of a professional. And thirdly, develop creative thinking and problem solving. So that will take care of your melting down child. Do not be afraid of emotions. It looks worse than what it actually is. So that's the first case study I want to talk about. And you're welcome to email me. And my email is aileda326@gmail.com, aileda326@gmail.com. I will respond to you. I will make sure that someone in my office will respond to you. And you are welcome to attend our webinar, or better still, in person. If you have any questions or problem with this type of children and or even teenagers or adults. So I want to talk about the second category. What happens when you have to introduce a sibling? I want you to think back. If you ever have a pet, do you think your house pet that you have had for 10 years will welcome the introduction of another cute puppy? See what's going to happen to it. Do you see defensiveness? Do you see territorial behavior? Well, I'm going to say, if it is a human person, this is going to be dialed up by many times. Territorial behaviors, defensiveness, sibling rivalry may be increase by 10 times, you see. So what you have to do, number one, is to have realistic expectation. You're not going to get, you cannot expect to introduce another sibling and be living as a happy family. That's not going to happen right off the bat. So have realistic expectations. Know that this is not going to be easy, and I suggest if you can get wraparound services from DCS or any kind of help, the more help, the better, because you are going to need it. Next thing you know, you should warm your child up to the new sibling. Don't just drop them in and then have them live in the house 24/7. It's a shock to the system. I suggest that you meet the new child, play with the new child as though this is a visitor. And then I would like you to pay fun activities together with the new sibling. Gradually, slowly, you actually warm them up to that concept, you see. So number one. And number two, you have to assure them this is their territory, right? Give them a room, personalize their room, tell them that you are the big brother or sister, you have been promoted. This is what you do with a regular neurotypical kid from a biological family too. They have been promoted, they have a privileged position, and give them extra attention. Help them transition to their new role as a big brother or sister, right? Now, sometimes they may not be. The introduced siblings may be older, but you can still do something similar, right? So there is a process. So to warm up, what happens when despite all you do, your child will just not accept the new sibling? It has happened, and we have to send off the new sibling to another foster adoptive parents. That has happened as well. So you would need to have a plan, which is why it's so important to enlist the help of professionals. Basically, you need a team of professionals to help you figure that out. There could be more serious maladaptive mindset that could have been lodged in the mind of the child, which takes a lot more to unravel. It can be done, but it's not something that you can do by yourself. Know that if you have problems, right, number one, it's not your fault, it's not the child's fault. Sometimes it's just a bit too complicated. And do your best to assimilate, but know that you can reach out for help. You can certainly reach out to us, and we can give you some resources and training. And another thing that we do is we do brain mapping. We will help you look inside the brain to see the extent of damage from the trauma, whether it's from the environment or inherited tendency. Sometimes looking at the brain, you will realize the capacity of your child and then act accordingly. So sibling integration is a wonderful thing. We want to do our best to keep siblings together when we can help it. So I want you to know that it's not an easy process. So if you are having problem, it's not personal. So know that we love children, and each child deserves a loving home. And I would like to thank you for opening your home for foster and adoptive parents. Thank you.